Good morning, dear students. Today we are going to discuss about the blood pressure and the factors affecting blood pressure. So your learning objectives will be you must be able to define the blood pressure and the factors affecting blood pressure. What are the physiological variations related to the blood pressure? So blood pressure. This blood pressure is defined as it is the lateral pressure which is exerted by column of blood on the wall of arteries while flowing through it. Right? So blood pressure is nothing but it is the arterial pressure. So it is comprising of the two readings, systolic blood pressure and the diastolic blood pressure. Normal values of blood pressure, they are variable. Systolic blood pressure normal values is varying from 100 to 119 millimeters of mercury in adults, while diastolic blood pressure value is 60 to 79 millimeters of mercury. Any value which is either beyond or less than, it comes under the category of abnormal. So systolic blood pressure ranging from 120 to 139 will be classified as pre-hypertension, while in case of diastolic blood pressure, values between 80 to 89 millimeters of mercury is classified as pre-hypertension. Pulse pressure. The difference between the systolic and diastolic blood pressure is called as pulse pressure. Pulse pressure is an important phenomenon because we need a pressure head difference which is responsible for flowing of blood through the arteries. Now what do you mean by mean arterial blood pressure? So mean arterial blood pressure is nothing but the average of the blood pressure. It is also called as mean arterial blood pressure. To calculate the mean arterial blood pressure, there is a mathematical expression. Mathematical formula is there to calculate the mean arterial blood pressure. So mean pressure will be equal to diastolic blood pressure plus 1/3 of the pulse pressure. For example, if the blood pressure of the patient is 83 by 50 millimeters of mercury, so his MAP by putting up the values in the formula would be 61 millimeters of mercury. As it is the averaging of the blood pressure and it is taken into consideration pulse pressure as well as diastolic blood pressure, it is the important parameter. Now classification as per the American Heart Association. So depending upon the readings of the blood pressure, so the person will be classified as a pre-hypertension or hypertension on the basis of the readings available as per American Heart Association. You can see there is a different color coding or a labeling of individual. So if the blood pressure, systolic blood pressure is less than 120, it is labeled as a normal blood pressure, and for diastolic it is the value is less than 80. So as the values goes on increasing, the rating of the hypertension category will be goes on increasing. Now, what are the factors which are affecting the blood pressure? Now we know that blood pressure is the amount of pressure exerted by the column of blood on the walls of arteries while flowing through it. Right? So mathematically the blood pressure is derived as cardiac output multiplied by the peripheral resistance. Now we know that what do you mean by cardiac output? Mathematical formula for cardiac output is equal to stroke volume multiplied by heart rate. Now what is stroke volume? Stroke volume is the amount of blood ejected by each ventricle per beat. It is called as stroke volume, right? So the factors which are affecting the cardiac output and which are affecting the total peripheral resistance will ultimately affect the value of blood pressure, because blood pressure is the product of cardiac output and the peripheral resistance. Now we will see what are the factors which are affecting cardiac output and what are the factors which are affecting the peripheral resistance one by one. Now this is the simplified diagram you can see. So first is the factors affecting cardiac output. Now we know that cardiac output is equal to the product of stroke volume and the heart rate. So factors which will affect the stroke volume and the factors which will affect the heart rate ultimately will be affecting the cardiac output and which ultimately affect the values of blood pressure. So stroke volume will be decided by such as heart size, fitness level of a person, gender, contractility, duration of contraction, preload, that is the end diastolic volume, and the afterload, that is the resistance. So stroke volume will be equal to end diastolic volume minus end systolic volume. Now this end diastolic volume which demarcates the preload for the heart, it is a very important factors which ultimately affecting the stroke volume. Now what do we mean by this end diastolic volume? So end diastolic volume is the volume of blood which is present in the ventricles at the end of diastole. Now during the phase of diastole, the heart chambers are receiving the blood from the periphery, right? So major filling of the atria which is happening during the diastole. Now this blood is moving from atria to the right ventricle, right? So because of that, the amount of blood which is present at the end of diastole, it is called as end diastolic volume, and out of which is going to be ejected by the left ventricle will be labeled as a stroke volume, right? So this stroke volume is very important and which will be decided by the as per Frank-Starling law, which states that force of contraction will be directly proportional to initial length of muscle fiber. So, and this initial length of muscle fiber, it is decided by the amount of blood which is present in the heart. So naturally, when the EDV increases, force of contraction increases, preload increases, which ultimately leads to the increase in the stroke volume, which ultimately leads to the cardiac output, which ultimately leads to the increase in the blood pressure. Now what are the factors which will affect the heart rate? Such as autonomic innervation. So sympathetic will increase the heart rate while the parasympathetic outflow will decrease the heart rate. Hormones such as growth hormone, thyroxine, adrenaline, this will increase the heart rate. Fitness level of an individual, for example athletes will be having increase in the vagal tone, so ultimately they will be having reduction in the heart rate. During the age, in case of infants and children, so heart rate is more. As the age advances, heart rate will be goes on reducing. So this is how these factors which will affect the cardiac output. Now next is the factors affecting total peripheral resistance. So resistance R and flow, they will be the affecting factors. It is postulated by Poiseuille's law. So Poiseuille's law, resistance R is equal to 8 eta L divided by pi R raised to power 4, where eta is the viscosity of blood, L is the length of the tube through which the blood is flowing. So here the length of the blood vessels, which will be the value of L, and this R will be the radius of the blood vessel through which the blood is flowing. Now at any given point of time, so length L, that is the length of the tube, so length of the blood vessel, which will be the constant for particular individual, and eta, that is the viscosity of a blood, so which is again instantaneously which will be the constant. So factors which is main governing the level of resistance is the radius of the blood vessel. So if the radius is increases, that means in case of bigger arteries, so total peripheral resistance will be less. In case of smaller artery, the resistance will be more. So this is how there is an interaction of cardiac output and the total peripheral resistance, which ultimately affect the blood pressure. Now what are the physiological variations? That means there is either increase in the blood pressure or decrease in the blood pressure without having any disease condition. For example, age, gender, eating habits, sleep, emotions and excitement, exercise, posture, temperature, and the conditions such as pregnancy. All these will affect the blood pressure. Now you see, so this is the tabulated format, how the various activities of yours will be affecting the blood pressure. So simple talking, now I am talking with you, you can imagine my blood pressure will be increased by 7 to 10 millimeters of mercury. Now you are listening my lectures, that means still you are having hike of 5 millimeters of mercury in blood pressure. For example, cross leg, no back support, arm unsupported, arm position with the center of bladder at the heart level, oscillometric device. So these oscillometric devices, these are nothing but the digital devices. So you can expect the variations of 10 in diastolic and 5 in 10 in systolic and 5 in diastolic variation. So that's why these are the factors you need to consider. So whenever you are measuring the blood pressure or demarcating the blood pressure. Thank you.